Hello, my name is Katie, and I'll be presenting on the political influence on women's health. Political influence on women's health is the ways that governmental policies and laws impact the way women can access health care, their reproductive rights, and overall health outcomes for women. This influence of politics can be exacerbated by legislation and laws, funding decisions, control of power, and differences in political beliefs. Women are disproportionately affected by this issue because it is the rights of women that are under fire in the political sphere, not the rights of men. Women's reproductive rights are what is under the microscope more, which is what makes that the focus, and the health of men is not only left out of the spotlight, but are guaranteed at least basic levels of healthcare rights at all times. Two major aspects of women's health that will be focused on in this presentation will be the reproductive health of women and maternal mortality. The two countries that will be focused on in this presentation will be the United States and France. Women's health is a very prominent topic in almost all news outlets we see today. Demographics of health issues affecting women influence this. Demographics of countries add into women's health. Aspects of culture affect women's health as well. Ethical considerations and governmental presence in women's health takes a very aggressive approach in today's world. Starting off, let's look at some history of the issue. In France, there is a long-standing history of state-supported healthcare, dating back to the creation of their universal healthcare coverage in 1945. Reproductive rights, including abortion, which was legalized in 1975, are protected by law, and maternal health care is heavily supported and funded by the government. In the United States, the U.S. has a more fragmented approach with their healthcare system. The Roe v. Wade decision in 1973 initially protected abortion rights, but upon its overturning in 2022, this led to state-level restrictions and bans. Maternal health care, along with all basic health care, is not universally accessible, leading to significant disparities among the population. The etiology for this issue is similar between both countries. Reproductive health issues stem from unwanted pregnancies, unsafe abortions, lack of care and education, and untreated medical complications. In the United States, restrictive policies exacerbate these risks by large margins. Maternal mortality is often a result of hemorrhage, high blood pressure disorders, and postpartum infections or complications. In the U.S., racial disparities mean Black women face higher mortality risks. Let's look at some risk factors among this issue. In France, there is low amount of risk due to their universal healthcare accessibility, comprehensive programs, and the wide use of contraception that is funded by their government. In the United States, risk is much higher due to the lack of healthcare coverage, lack of insurance coverage, racial disparities, and highly restricted access to reproductive healthcare services and programs. In France, the maternal mortality rate is about 8 deaths per 100,000 live births. There is high rates of conception used across their population, and abortion is safe, legal, and widely available. In the United States, maternal mortality rate is about 32 deaths per 100,000 live births, which is about 4 times as much as France. Also, it is one of the highest among developed nations. In the United States, there is also limited access to contraception in certain states, and abortion restrictions are increasing, which is leading to the unsafe conditions for abortion procedures. Within women's health and the political influence on women's health, There are many physical, social, and emotional implications. Some physical implications include increased rates of pregnancy complications, which lead to increased risks for unsafe abortions. Some emotional implications include rates of anxiety, depression, and trauma-related responses from restricted reproductive rights. Some social implications include economic burdens from unplanned pregnancies, a decrease in participation in the workforce, and an increase in financial instability. In France, because of government-funded healthcare and universal healthcare access, there are a few barriers. Maternal programs, legal abortion access, and removed stigma from women's healthcare all contribute to this. In the United States, there is a lack of universal healthcare. Also, state-level abortion bans and restrictions, racial disparities in maternal care quality, and high maternal care costs, especially for uninsured women, contribute to the barriers in the United States. Political frameworks and economic factors play a large role in the influence of politics on women's health. In France, 75% of women use modern-day contraceptives. Their universal healthcare system covers nearly 100% of pregnancy-related costs. Their government has pro-choice laws in place, like the legalization of abortion in 1975, which in 2022 was extended to 14 weeks during a woman's pregnancy. France's government also allows for free contraception methods, and it's available to all women under 26, which was made a law in 2022. Government-funded healthcare removes all cost barriers to the population needing healthcare. They also have paid maternity leave, which is 16 weeks minimum, which promotes the maternal health. Going off of the previous slide, society, religious beliefs, education, and environmental factors all play influence on women's health. France has what's called a secular society, which means they have less religious influence on when it comes to reproductive rights. They also have comprehensive sex education, which contributes to lower teen pregnancies. France has a 99% literacy rate, which is extremely high, and a strong public health campaign, which supports informed reproductive choices. Large amounts of France's population live in dense urban centers as well, which is more easily accessible to maternal care and hospitals. Low levels of pollution and obesity also contribute to better pregnancy outcomes. These same types of factors in the United States influence women's health, but quite differently. In the United States, there is no universal health care, which leaves much of the population uninsured. Roe v. Wade was overturned in 2022, which led to state bans on abortion and much more harsher restrictions. There's inconsistencies to the Medicaid expansion program, which limit maternal health care in certain states. In the United States, healthcare costs are much higher. The average birth costs $18,865 out of pocket for those uninsured. There is also a lack of paid maternity leave, which forces women to return to work too soon. Religious conservatism is what drives abortion bans and restrictions in multiple states across the U.S. Sexual and reproductive education is also very inconsistent among states, with some states emphasizing abstinence-only programs. Lower rates of sexual and reproductive health education can correlate with higher teen pregnancy rates in some conservative states. Much larger amounts of the population live in healthcare deserts in the United States as well. Healthcare deserts are rural states, particularly in the South, that lack maternal health care facilities. Higher rates of obesity and chronic health disorders also increase pregnancy complication risks. Sociocultural factors play a large part in the political influence on women's health. In France, there is a prevailing culture which, like mentioned before, is largely secular, with a strong emphasis on gender equality and state-supported healthcare. Reproductive health is viewed as a fundamental right, as it should be, leading to policies and laws that prioritize accessible contraceptive methods, legal abortion, and comprehensive maternal care. The French government also plays a central role in ensuring healthcare access. The belief in collective responsibility for health ensures low maternal mortality and high reproductive autonomy for women. Sexual and reproductive education is mandatory in France, reducing teen pregnancy and unsafe abortions. As mentioned before, free contraception for women under 26 further decreases the unintended pregnancies. Gender norms and feminism play a large role as well. France has a strong feminist movement advocating for women's autonomy over reproductive choices. This influences policy decisions and strengthens legal protections for reproductive health for women. Barriers that still exist in France include things like medical discretion on late-term abortions. Although abortion is legal up to 14 weeks, doctors can refuse to perform if it is past that period, which can create some delays. Rural healthcare gaps also pose a barrier. Some rural areas lack specialists, which can lead to delays as well. On the other hand, in the United States, there is a prevailing culture in which the United States has a highly politicized healthcare system, with reproductive health being shaped mostly by religious, political, and economic factors. Women's reproductive choices are often framed as moral or political issues rather than medical rights. There is often a large religious and political divide as well. Many states have strong religious opposition to abortion and contraception, leading to restrictive laws and reduced access to these things. Healthcare inequality and racial disparities are not uncommon in the United States as well. Unlike France, the United States does not have universal health care, which makes care inaccessible for many low-income women. Racial and economic disparities mean that Black and Indigenous women face significantly higher maternal mortality rates. Gender roles and political polarization is a huge role as well. Women's reproductive rights are often framed as a partisan debate where consecutive ideologies seek to limit access to abortion and contraception. Women's autonomy is frequently challenged by male-dominated legislators as well. Barriers that definitely still exist in the United States include things like legal restrictions on abortion and contraception, healthcare costs that prevent many from receiving proper maternal care, gender bias in medicine which leads to women's pain and complications being dismissed, and racial disparities mean women of color are facing worse maternal health outcomes. In my research, cultural beliefs on women's health was seen to be very different between France and the United States. In France, women's health is seen as a public health priority. Government intervention ensures reproductive rights are always going to be protected for women, and women have greater reproductive autonomy over their own choices. There is still some stigma that remains in France about having abortions and being a single mother in conservative areas of France. In the United States, religious conservatism places moral judgment on reproductive choices. Abortion bans and restrictions force women to seek unsafe procedures. Women in marginalized communities struggle with systemic biases in healthcare, and hierarchies of power control most of women's autonomy of reproductive rights. As you can see, this is a large difference from France. Power hierarchies and bias in healthcare is seen most dominantly in the United States. The first point being male-dominated legislators. Policies restricting reproductive rights in the U.S. are often decided by male politicians with little medical expertise. We see this every day of our lives currently. Racial bias. Like in the United States, Black women are 3 times more likely to die from pregnancy-related complications due to systemic racism in healthcare. There is also economic discrimination. Wealthier women in the United States can travel, for example, for reproductive services, while low-income women face the highest barriers. Addressing women's reproductive health and maternal mortality. In France, there are many government initiatives, things like universal health care, which covers nearly all pregnancy-related expenses, ensuring that maternal care is accessible and affordable. There is expansion of free contraception. Women under 26 years old receive free contraception, reducing unintended pregnancies. The legalization for abortion in 1975, which was later extended to 14 weeks of a woman's pregnancy in 2022, and government investment in women's health research is also seen today. Other things like local and global organizations. Something called the Fondation des Femmes is a leading nonprofit advocating for women's health rights, including reproductive access and maternal care. France has family planning centers, which provide free reproductive health counseling, contraception, and abortion support. France also works with the World Health Organization to promote maternal health worldwide, offering expertise and funding. Also, like mentioned before, there are large feminist movements in France. Groups like Nous Toutes advocate for women's reproductive rights and fight against healthcare inequalities. French doctors and midwives actively support women's autonomy in reproductive decisions and advocate for policy improvements. In the United States, government initiatives are occurring. Medicaid expansion, for example. Some states have extended Medicaid to cover pregnancy-related care for low-income women, but 14 states have refused expansion, leaving gaps in access. Title X Family Planning Program provides affordable reproductive health care, though funding has been restricted under conservative administrations. State-level responses to maternal mortality. Some states have created maternal mortality review committees to investigate pregnancy-related deaths and improve care. On a local and global organizational level, Planned Parenthood is a good example. This provides reproductive health care services, including contraception, cancer screenings, and prenatal care, though access varies due to state restrictions, and it is under a lot of scrutiny currently. The ACOG advocates for better maternal health policies and the right to evidence-based reproductive care. Every Mother Counts is a global nonprofit working to improve maternal health outcomes, with efforts addressing racial disparities in U.S. maternal care. There are reproductive rights activists in the U.S. as well. Reproductive Freedom for All and Women's March protest against abortion restriction and advocate for bodily autonomy. Both countries have a responsibility to reduce maternal mortality, ensure reproductive autonomy, and promote equitable healthcare access. More specifically, France has the responsibility over public health over ideology, ensuring universal healthcare and reproductive rights. French society supports state intervention in healthcare as well, reinforcing women's health as a collective responsibility. Nonprofits and advocacy groups work closely with the government to maintain reproductive rights protections as well. In the United States, the federal government remains unfortunately divided, leading to state-based inequalities in reproductive health care. Civil society, medical organizations, and activists do play a critical role in advocating for policies to support reproductive health. In France, there are many ethical strengths. Women's autonomy is protected through legal abortion and contraception access. Healthcare is accessible, reducing financial barriers to maternal care, and government prioritization of public health minimizes corporate and religious influences. The only ethical constraints might be the doctor's conscience clause, which relates back to the late-term abortions, and rural healthcare disparities, which make women in remote areas face longer wait times for reproductive health services. Unfortunately, there are many ethical challenges in the United States. Lack of universal health care creates economic discrimination in maternal and reproductive care. State-level abortion bans remove women's autonomy over their own bodies. Racial and economic disparities are still very prevalent today, and religious influence on policy conflicts with medical ethics, restricting evidence-based care. Some ethical constraints include doctors that can receive legal punishment for performing abortions in anti-abortion states, and conflicts between religious freedom and reproductive rights impact healthcare policies greatly. In wrapping it up, the political landscape and healthcare policies of a country do play a very decisive role in shaping women's reproductive health outcomes, as seen in the large contrast between France and the United States. France's universal healthcare system, legal protections for reproductive rights, and government prioritization of maternal health ensure greater equality and access to care for women. In contrast, the United States' poor healthcare system, political polarization, and state-level restrictions on abortion and contraception create significant disparities, particularly for low-income and minority women. Addressing these challenges in the United States would require policy reforms that prioritize healthcare accessibility, racial and economic equity, and the protection of reproductive autonomy from political and ideological interference and influence. My discussion questions for the class include: how do you think the political and cultural landscape in our own country influences women's access to reproductive health care, and what changes, if any, do you think should be made? Also, in the face of political and ideological divides, what role should individuals, healthcare providers, and advocacy organizations play in ensuring access to reproductive health services? Thanks for listening.